South Wales Premier Gladys Berejiklian.
Today we had just up to 3,500 people were tested and only 6 people were identified as having the virus. So obviously we're very pleased with that statistic, and we want to encourage all of you who have symptoms, especially in those high-risk communities, to please come forward and get tested. For a Sunday, those numbers are good, and in fact the fact that we only had 6 cases identified is also very positive. But we know that whilst we're tackling the health impacts of the virus, there are also devastating economic impacts, and New South Wales wants to ensure that all businesses that are currently working to keep going hard, and also to provide opportunities for others to restructure, get their employees back out there and working, and that's a high priority for us. But we also know that for every job we create, every business we support, that's less stress for families and households across the state. I'm very pleased to have the Deputy Premier here with me today because the New South Wales Government is announcing an additional $140 million to go into those primary industries in our regions, agriculture, forestry, etc., especially those communities heavily impacted by the bushfires, because we know the agriculture and primary industry sector isn't as impacted as others when it comes to the virus. They're able to keep growing, they're able to employ people, and they're able to be supported, especially given the huge hit they took over summer with the bushfires. And that is good news, because not only does it mean jobs in the bush for those communities that have been impacted by the bushfire season, but it also means jobs in the cities when those supply chains, those distribution networks, freight and logistics come to the cities. So it's good news all around, and the Deputy Premier will provide further detail on that positive announcement. But of course, our focus remains in New South Wales on keeping the spread, stopping the spread, containing the spread, but also reducing the community-to-community transmission, and that's really, really important. So everybody's been doing really well in the main in terms of respecting the restrictions, and we ask that to continue. We're pleased with the trends, and of course remaining consistently low is our challenge. Some days we get higher cases, other days we get lower cases. So for us, maintaining that low consistency is really, really important, as is making sure we reduce that community-to-community transmission, because that is what can cause a flare-up. That is why we have to stay vigilant, because when you stop trying hard, it can spread very quickly, and that's the last thing we want. But again, in addition to making sure we have the right support systems in our health system, it's about making sure we keep the economy going as much as possible, we keep the jobs going, and we support our communities who have been impacted by the horrible summer season, but also those communities, because of what they do, are able to employ people, keep jobs going, and that has a positive impact across the state. I'll ask Dr. Chant to give her health update, and then the Deputy Premier will provide further detail on our announcement today. Thank you.
Thank you, Premier. So there were 6 new cases and 3,489 people tested as of 8 p.m. on the 19th of April. There's 30 deaths in New South Wales, with 1 death in the past 24 hours. There are currently 249 COVID cases being treated by New South Wales Health, and this includes 22 people being treated in intensive care units and 15 of those requiring ventilators. In terms of testing, I'd like to acknowledge and extend my appreciation to the community for embracing our testing messages. There have been nearly 4,000 more people tested in the past week than the previous week. I'd like to see those numbers continue to increase. So our areas of higher testing for this week are listed on the New South Wales Health website, but they include local government areas of Blacktown, Canada Bay, Cumberland, Goulburn, Mulawarie, Inner West, Liverpool, Parramatta, Penrith, Randwick, Ryde, Waverley and Woollahra. So anyone in those areas that have symptoms of fever, cough, sore throat, runny nose should present for testing, and we are trying to have high testing rates in those areas to again assure us that we are not missing more widespread community transmission in those areas. What's prompted us to nominate those areas is that we have a weekly review of cases where we haven't got identified sources, and this allows us to focus on those target areas. In addition, I'd like to re-emphasise that anyone who is a healthcare worker, working with vulnerable groups, a disability care worker, anyone who's working in an institution with vulnerables, including prisons or detention centres, boarding schools. If you developed any symptoms, again with fever, shortness of breath, cough, sore throat, we do urge you to come forward for testing. And the rationale for that is that the implications of you introducing COVID into those institutional settings can be quite significant, because we are aware that in those settings we see quite an amplification and spread of COVID-19. So we want to interrupt spread in those settings at the earliest possible time. In relation to the outbreak at the Anglicare Newmark House, there has been one death related to COVID-19 in the past 24 hours, making it 2 deaths at that facility. A 94-year-old man confirmed COVID positive has passed away. And at the Newmark House aged care facilities, there's been 2 additional cases in that 24-hour period, and that brings the total to 41 cases, 14 staff and 27 residents have tested positive. Thank you.
Well, good morning. The New South Wales government is still focused on